It's sadness for our society. It's sadness that we haven't solved the problem. And I think it redoubles our efforts to try to think about how we can address the problem of gun violence, not just for mass shootings, but for the everyday events that we see in our trauma centers. I think it's important to recognize that that mass shootings represent 1% of the firearm violence problem in this country. And it's a horrible thing, and we have to solve it. But we have to tackle this big picture, the 40,000 people that die every year in the country from firearm violence, and we can't forget them. If you look at the numbers, this last year is the first year that there were more deaths in the United States from firearm injury than from motor vehicle crashes. Now, years ago, motor vehicle crashes by far and away were our leading cause of death from traumatic injury. If you think about a problem like that from a comprehensive public health approach, then you can see that if you study the problem, and you invest in research to study the problem, and then you develop interventions based on that research, that you can have a dramatic effect. And we have cut the deaths and disabilities from motor vehicle crashes dramatically since the 1960s. We could do the same thing with this problem if we focus on it in that way. But I think that if we take a public health approach, if we think of it the way we thought about motor vehicle crashes, or about how we've dealt with smoking or other public health problems, then I think we have a real opportunity to do something. And I think throwing up our hands and saying, oh, we're never going to solve this because it's just politics, is a mistake. There's a tremendous amount we can do if we just sort of recognize that there's an approach to this that's not political, not challenging the Second Amendment, but how can we identify the root causes of violence, manage those, and how can we make firearm ownership as safe as possible? From a personal preparedness standpoint and for protecting your family, making sure that you have Stop the Bleed training and you have the equipment available, I think is a very good step.